Welcome everyone. This is the ISFTD Interview Series, and today we have the honor to interview Dr. Luisa Gorno Tempini. Luisa Gorno Tempini is a professor of neurology and psychiatry and works as a behaviour neurologist, and also holds a distinguished professorship in dyslexia and neurodevelopment. She's currently the director of the Language Neurobiology Laboratory at UCSF Memory and Aging Center, and also co-directs the UCSF Dyslexia Center. So we're very happy as the ISFTD community to have you here today. We set out a poll on our Twitter to ask the community what they would like to ask you in an interview if they were present today. And the first question was basically to ask maybe if you are excited or happy to share one of your latest publications or findings that you can share with us.
Thank you. Thank you for having me. It's an honor to be here. I think what I'm most excited about in a recent publication, I think from last year, is the first try of kind of putting together what we've learned in the past 3 decades about language and behavior, and kind of integrating these notions between language researchers and emotion researchers to try to define the syndrome that really affects the right temporal lobe, the right anterior temporal lobe. So the way that I think about it now is that we have a combination of clinical syndromes that we call semantic dementia, in which semantic memory is mainly involved, and then we have a more left version that we call semantic variant PPA, and a more right version that we've called semantic behavioral variant FTD, and really trying to figure this out and how the relationship between the two frontal lobes is, it really gets to the passion of what I love to do, which is take basic science and convert it into something that is relevant for our patients diagnostically, prognostically, therapeutically. And I think we still have a lot to do on figuring out the relationship between the right and left anterior temporal lobe. And I think our field has a huge opportunity because it's an area that is difficult to study. It's not hit often by stroke. It's hard to image in functional imaging. So I think we have the opportunity and also the duty to really figure this out for science and for our patients. So the paper that we put out last year was really the experience of the UCSF Memory and Aging Center in studying these patients longitudinally and trying to come up with some criteria to define them. And it's a work in progress. There is a big international group also working on it. And so I'm really excited about how this is going to go in the next few years.
I think most of us, of course, read the paper, and it's actually also so what Kirana and I were discussing the other day, like, how do you feel you stand as a language expert, but also behavioral neurologist expert? Like you were just saying, it really nicely overlaps this phenotype you're trying to explain and to study. Like, how does that feel for you? How do you, with having this expertise in both areas, how do you feel that that can help you, or maybe that's also could also be maybe a pitfall?
Absolutely, it's been so interesting, and that is like, I feel so fortunate at UCSF to have Dr. Virginia Sturm and Kate Rankin, who really concentrate their career on studying on one side the physiology of emotions, and on the other that's more Virginia Sturm, and then Kate Rankin thinking about social cognition, and I've learned so much from them, and I think they can maybe learn something from our field that of language, on how we've created models of language functioning and interactions between the different components of language, like single word comprehension and knowledge and syntax, and how we can try to kind of combine the worlds more. But we can use language as a window into behavior as well. What type of language, what type of words a person uses, and in what context to describe events in their life, I think it can be hugely impactful. So that's part of what really excites me. It's like, okay, let's bring these worlds together because they've been very parallel. And then we add psychiatry to it too, right? And how symptoms are described in psychiatry don't always match what we see in our neurological patients
right now. And I really like the way you're saying, like, we can use language to actually measure also behavior and to understand behavior. How has that, was that something already sparking your interest as a behavioral neurologist in the clinic prior to research, or is that something that developed throughout?
I think I've always been interested in how thoughts and behavior emerge from the brain. For some strange reason, since I was very young. I don't know. I guess it's my nerdy nature. I don't know. But and then, you know, I trained in Italy. I'm from Italy, and behavioral neurology was language in Italy. So I was lucky enough to have you know, contact early in my career during medical school with you know, Professor Vignolo and Kappa and De Renzi, and really the founding fathers of language behavioral neurology. So I concentrated more on language, but I've always been interested in the kind of combination and on really human thought and thinking.
What do you think the future will hold? Like, what do you think the next step should be?
I think we need to embrace the new technologies, and you know, that give us opportunities to objectively also trace some aspects of behavior and language. And there's a huge opportunity there, you know, techniques for facial expression recognition and acoustic analysis, linguistic analyses. They're never going to substitute a clinician. I'm convinced of that, but they can be incredible tools. I also think that our society is starting to be more ready to think about emotions and behavior coming from the brain, right? I'm hoping that in the next few years, we can get it to a level in which we can measure people's, you know, word finding latencies and record them just as we record height and weight, you know? So I think technology hopefully will help us normalize some of the brain assessments that we've all been working on for decades.
I'm hearing a lot of interdisciplinary collaboration, right? How do you think the ISFTD or other FTD communities or research collaboration can be of aid here?
I mean, hugely. I think the network of both caregivers, practitioners, scientists that the ISFTD created is amazing and very important as we get into complex linguistic and behavioral societal issues. Is we need to consider multicultural aspects, right? That's another field that I'm really excited about, that technology can help us. And, you know, looking at, you know, cross-linguistic diagnostic and therapeutical approaches and transcultural. And, you know, we know that we're dealing with rare diseases. So finding ways to work together is super important. And sometimes language barriers have been an issue and cultural barriers have been an issue. But again, I think that maybe I'm an optimist by nature, but I think that these technological advances can help us understand how we can pull resources. And maybe I'm really optimistic that the new generation with your new training or way of thinking will be able to implement maybe some of the discoveries that we more senior generation have made, and for more impact.
Yeah, I already hear some advice coming for the early and mid-career researchers here. So maybe that's a good point to move towards that topic as well, that the ISFTD community was hoping to hear from you. So is there advice you could give to specific FTD researchers, early and mid-career researchers?
I think it's important to specialize in something that you're really passionate about. I have one expertise that is your thing. For me, as a junior researcher, was functional imaging. Then I had one behavior of interest that at that point for me was language and semantic memory, and I really studied that in detail. And then from there, I just started expanding and be open to new technology and new approaches and to colleagues around me. And as you get further in your career, you might lose the technical details that are more up to date in your technique. But it's okay. You'll always have that base to build upon. I think it's important to specialize in something at the beginning, one technique, one behavior of interest, and then expand from there. And always keep an eye on the patients. For me, that's where you get your inspirations and your ideas.
Mental, you study both neurodevelopmental and neurodegenerative disorders. And I was wondering, how do you see they're related? What can we learn from both of these worlds?
Was really inspired by the work in FTD and primary progressive aphasia and trying to think about selective vulnerability, which is something that I think we're all very interested in, why some people develop with the same disease language issues and others behavioral issues or visual spatial issues, and how we're built really influences how we age and how diseases of aging manifest. So Zach Miller's first observation that many patients with PPA, and I mean in our group, first observations, there are others, of course, that had this observation before, and how there is a higher frequency of neurodevelopmental issues. And I think we're seeing it in familial FTD as well. There might be neurodevelopmental effects of the genes as well. So I really see it as a lifespan approach. I don't see it that differently. And I think what we've learned of studying cognitive and behavioral symptoms over time in aging is also very useful through the neurodevelopmental work that also expands over time. So I think both technique-wise, neuroanatomically, and it's been very inspirational to me, and I'm really proud when the fellows present cases to me now at UCSF, and they always tell me that patients' neurodevelopmental history as part of an aging disease assessment, and that the neurodevelopmental field had a lot to learn from us, and vice versa. So it's been a lot of work, but also really inspiring and fruitful.
Do you think we can actually inspire someone maybe from a completely different field, like you said, the bioengineering field? How do you think we can spark their interest as well to already be involved from an early career stage as well?
The way that I always approach collaborations is thinking first, what can I offer them? What do I, don't go and ask for something, go and offer something. And that usually opens a door. You research, you decide what you need. And then you can think about what the data that you have or the question that you have can improve their science or their implementation. And that's how I think you find the right match. And then usually many people who do a lot of theoretical technical work really want to do something impactful. So I would encourage to be brave and go for it. And maybe sometimes you'll find closed doors, but I assure you, you'll also find at some point an open door.
So I wanted to also ask you some other completely non-academic questions. Are the right person to ask if I would go to San Francisco next week? I wish, but if I would, what would the place to be? What would you advise me to go, and why? It could be
my favorite ever place in San Francisco are the beaches. So I would encourage you to go for a walk at Crissy Fields, and when you're in the kind of midway in this walk along the beach, you look to the right and you see downtown San Francisco, and you look to the left and you see the Golden Gate Bridge, and it always gives me goosebumps thinking about, you know, the wild and the city. And the Golden Gate Bridge to me is an hymn to human ingenuity. So that's, to me, looking at the Golden Gate Bridge is just like looking at the Tower of Pisa. You know, it's like one of these incredible human achievements and respectful of nature, and it's just one of my favorite places in the world. So
if you could ever relive a scientific conference, which one would it be and why?
My academic life actually had three worlds, you know, Italy, the UK, where I did my PhD, and then California, San Francisco, where I did my fellowship, and then my career. I really love the ISFTD conferences. They're always my favorite. I wish we could do it every year. It's really our community. And maybe something that I would do differently is I was asked to do a symposium at the Munich conference, and I don't know whether during that conference I was inclusive enough in my symposium without realizing. And so I've always thought about, well, maybe if I did it again, it would be more multidisciplinary and multicultural. And it was kind of a few years back, and yeah, I'm not sure this is exactly what you were asking, but I think it was the first time that I was charged to be, you know, the leader of a symposium, and I was quite inexperienced about it. And I think, I'm not sure, I think I would do it differently today if I was to go back. I think it was great anyway. I hope it was, but you know, I don't want to, you know, diminish anybody who gave talks during that session. It's nothing to do with the actual talks or outcome. I just think that if I had the experience now that I have now, then I probably would have made it more multidisciplinary and more multicultural.
Personal question to end with. What is your favorite music to listen to when writing, or do you not listen to music when you're writing?
Oh, when writing, that's a very interesting. I love to listen to drum and bass when I write. It's my grant music. I have a dear friend who's a basic scientist, Matteo Carandini. He's a basic scientist at UCL, and we exchange playlists on drum and bass, and we call them our grant playlist. So, you know, most of it doesn't have words, and it's very activating and upbeat. And so that's definitely my writing music. I'm not sure it would be my favorite music in the world, but it's definitely my writing music. I highly recommend it. It's activating, not distracting, and yeah, I love it. It reminds me of my days in London where I used to go to drum and bass clubs, which is not really part of my life now. That's definitely my writing music.
Nice. Yeah. And is this a playlist we can access on Spotify, or is this not possible?
Oh yeah, I mean, you can type in drum and bass into Spotify and we'll come up with, but I'll see what Matteo thinks about making our playlist public. That would be fun.
Thank you again for making the time to meet with us and to be one of our guests on the ISFTD Interview Series. Joanna, I'm not sure if you had any other final...
I would like to thank Marilu for this always inspiring, thought-provoking and really learning experience.
Thank you for your interest and for all your work, to both of you, for all of the work that you do for ISFTD. It's such a gift to all of us. So thank you.